Good afternoon, and thank you for joining us again. I'm Dr. Martha Buchanan, Public Health Officer and Senior Director of the Knox County Health Department. We want to begin by extending our deepest sympathies for those who were affected by the devastating storms overnight in the Chattanooga area. Our thoughts are with those families who lost loved ones and the many first responders who are working to support their community members amid already difficult times. Today, our moment of gratitude is dedicated to our numerous city and county partners who have joined the COVID-19 response in Knox County. Our IT department has worked diligently and enabled us to do this meeting virtually for a little over a week now. We have members of both mayor's office, the libraries, Attorney General's office, 311, Knox County Emergency Management Agency, and many others participating in our response. We couldn't do this without them. Just like we can't protect our community without you following safe guidelines for social distancing and staying home as much as you can. We are sincerely appreciative of our partners and what our community is doing to help protect each other. Moving to our local situation. We have 166 confirmed cases of COVID-19 in Knox County. 126 of those have recovered. 20 individuals have been hospitalized at some point during their illness. And we thankfully are able to say we do not have another death from COVID-19. We want to take this time to offer a quick clarification about the differences between the numbers we report and the numbers on the state's website. There can be discrepancies for a few reasons. First, we post our numbers at 11 a.m. So that means we pull that data out earlier in the day than they do because they don't post it until 3 p.m. Central Time, which is actually 4 p.m. here. Or is it? Anyway,
it's 3 p.m.
It's 3 p.m. here, sorry. So lab results are received through the day. So there may be some labs that come into the State Department of Health that weren't in at 11 a.m. when we pulled our data. Also, all of the data is put into this statewide system for the local jurisdictions then to go in and do their investigations. And sometimes through that investigation, we might find that there's duplication and we clean that up. So the numbers that we put out at 11 o'clock in the morning are the most accurate numbers for Knox County related to COVID-19. Additionally, on Friday, we added a map to our website that shows positive cases by zip codes. This map is meant to provide a general geographic overview of positive cases in Knox County and does not account for population. We also added a chart for race and ethnicity data. However, because numbers are still low in these populations, it is not scientifically appropriate to draw conclusions from this data at this time. In addition, continuing to expand testing will help us better understand the burden of disease in our community. It's important to remember that unfortunately, access to care was an issue before this pandemic, and it remains an issue today. This is one reason we have expanded our testing to help cover those folks who don't have insurance so that they can have access to testing. And we're looking at other places where we might offer testing throughout the community. And now I'll open it up for questions.
If you have any questions, please go ahead and submit them into the chat feature. All right, from WBIR, do you expect the governor will extend the stay-at-home order? If not, do you anticipate re-upping the Knox County order, and why?
So I'm not sure what the governor's going to decide. And I've been in conversation with Mayor Jacobs, and we plan to wait to see what the governor announces, and have talked about what we will do if he does not extend the order. We agree that we're not quite ready to come out of the restrictions on travel and social distancing at this time.
From the Compass, the map on the website shows most of the cases involve residents living in an arc running through North, West, and South Knox County. What does the data tell you about the distribution of the coronavirus in Knox County?
Well, what we know is that we see when we look at the maps, we do see concentrations in certain zip codes. And so what we can infer from that is that there are definitely confirmed cases in those zip codes. What we don't know is testing availability throughout the county and in other zip codes. So it's a reflection of disease, but is it also potentially a reflection of access to testing? Something we are trying to address, and we are encouraging providers throughout the county to make testing available to their patients so that we can better understand the burden of disease throughout the whole county.
Question from Monica from the Sentinel. Monica, I believe she answered your question when she answered Cole's question, so let me know if you have any follow-up there. From WVLT, are there plans to house healthcare workers in university dorms or in local hotels to avoid the possibility of infecting their families?
We have not had those conversations with our hospitals or healthcare workers. I know that other communities are doing that. We would certainly facilitate that conversation and see if that's something that's needed, see how we could help make that work.
From WATE, what's the most important numbers the health department looks at? Is it number of recoveries, looking at number of active cases, et cetera?
Right. So what I would say is that the most important number we look at is the number of positive cases. Recoveries are really encouraging. We're really thrilled that people are getting better. But for us working right now, where we are in the trajectory of this outbreak is that we're looking at positives, because looking at the positives enables us to isolate that person that we know is sick, protect the people that are at risk that might have come in contact to them, which also protects the larger community. So that's really what we're concentrating on right now. And that's reporting and contact tracing. We're also wanting to increase testing because, again, that helps us do our job better. That helps us be able to isolate the people who are cases, protect the folks that might be at risk, and again, reduce the burden of disease in our community.
From the News Sentinel, are there concerns about how long it is taking for test results to come back? Are there any plans to try and speed up that process?
Yes, certainly. If it takes a long time to get test results back, that's a challenge. We want to know sooner rather than later. What that means for that individual is they're in isolation until their test results come back, and they may be feeling fine and actually be ready to come out of isolation, but we can't let them until we get their test results back. So we have to wait on those things. So I think that laboratories are working hard to improve turnaround time. The challenge is as we increase testing and put more tests into the system, the turnaround time gets lengthened again. So they're working diligently to improve turnaround time and get results back out to the public quickly.
From WBIR, what would it take for you to feel comfortable beginning to lift stay-at-home restrictions? And their follow-up is, how would that work and what would reopening look like?
Well, it's a great question, and nobody has the answer to that. This is untested territory. We're actually talking conversations about what that would look like in Knox County with our city and county partners. And so what we need to see is cases going down, and not going down just for a couple of days, but a trend of cases going down as opposed to continuing to go up, which is where we're going now.
From WUOT, could you tell us a bit about serological testing and how it identifies immunity or other effects on the people who have recovered from COVID-19? Can it tell us if someone who was asymptomatic had the illness, recovered, and didn't even know it?
Okay, I'm going to try to answer that, and if I don't, I'll send another question in. So what I know about the serological tests that are out there right now, they are not validated tests. They're having some challenges with getting those tests validated. I actually had a conversation with a laboratorian this morning about those tests. They're promising, and we're hopeful that we'll be able to use them, but they need to be validated. And I'm not totally familiar with all the FDA regulations. I know they have not been required to undergo the same scrutiny as some of the other testing models that we're using. But what we're finding is laboratories are having a hard time validating that it's an accurate test. So to use it to make any decisions, you want it to be a valid test. So at this time, we can't use a serological test to make any decisions.
From WBIR, where are we on the curve, and does successfully flattening the curve mean this will be over sooner?
So where are we on the curve? That's easy. We're at the beginning. We're still on the upslope of the curve. Successfully flattening the curve will mean that our cases we see a slowdown in the number of new cases is when we know we're flattening the curve. But we need to see that for several days. One day of fewer cases does not mean we flatten the curve at all. And honestly, one of the challenges with this approach is that flattening the curve might actually mean we have people who are sick a little bit longer than we would if we go whoop real fast, up real fast, and have a really fast peak. But the challenge of that fast peak is, one, more people get sick, more people die. We totally overburden our medical system, and the economic impact is greater. So we don't want that to happen. So we want to have that flatter curve. So we want to keep these things in place. We know they're working. We know evidence tells us and history tells us that social distancing works to reduce illness.
From the Compass, you mentioned testing, and last week Charity Menifee said the health department would expand the number of symptoms used in the criteria for testing. Has that decision been made? And if so, what are the added symptoms, and are the other criteria the same? Travel and exposure to people who have tested positive.
So obviously, travel is less of a consideration, still there, but we're not traveling as much as we were. Exposure to a known positive is still on there. But what we did is expand our list of symptoms to include not just cough, fever, and shortness of breath, but we added some of the other symptoms that we've seen reported for COVID-19: loss of smell, loss of taste, and some GI symptoms as well. So then we've expanded that list, and we've also expanded, not really expanded, but are testing more people, targeting those people that are highest risk for complications. So they may or may not have symptoms, but they're highest risk for complications. We're going to offer testing for them. So those are folks with chronic medical conditions. And we're also opening up testing for healthcare workers who may not have access otherwise, so that they can get tested and they can know if they can go back to work safely or if they need to stay home.
From WBIR, they say a little out of left field, but have emergency planners been asked to poll local restaurants if they would be able to prepare meals to feed people if there is a food shortage? Other counties in Tennessee say the state has asked them to do so. Is this the case in Knox County?
I'm not familiar with that ask coming down from the state. Of course, it could have come down through a different avenue than through public health. It might have come down through emergency management, and I just don't have that information yet.
From the Compass, the map on the website uses data through April 4th. There are 115 cases in 10 zip codes and an undisclosed number in 11 others. But the daily case counts show fewer cases through April 14th. How many total cases were used to generate the map, and why are the zip codes not identified if they have fewer than 5 cases?
Okay, that's a lot. That's a lot in there. So,
do you want from the first question?
Break it down for me. Thank you. Sorry.
Yeah, so they're asking, does the daily case count, it shows fewer cases through April 14th than what was on the website. So they're asking how many total cases were used to generate the map.
You mean April 4th or 14th?
April 4th is when the symptom onset, if we want to just kind of clarify that we have changed up the wording on our website.
Okay, so the way we pulled the data is we pulled by onset of symptoms. We went back to April 4th or earlier to pull that data. Onset of symptoms is the most reliable data that we have, as opposed to when the report comes in. Onset of symptoms is more reliable, more consistent. So the data is accurate as of the day we pulled it, April 10th. So we pulled it on April 10th, but it's data back through April 4th. We're going to clarify that language. We realized that was a little unclear on our website. So we're going to clarify that language. So symptom onset, April 4th or before. The date it's pulled is the date it's pulled, and that's how many cases we have as of that date.
And then a secondary question was, why are the zip codes not identified if they have fewer than 5 cases?
In part because we have concerns about people being identified to be a case. Anecdotally, in other jurisdictions, people have been actually had threats to their lives, or their children have been bullied. People have lost their jobs when they've been identified as a case of COVID-19. So we're really trying to protect those folks, those things from happening here. Once those numbers get up higher, we'll report those just like the rest of them.
From WBIR, for tests taken at KCHD, any idea how long results are taking?
Right now, our results are coming back in 3 to 4 days. If
there are any other questions, please go ahead and submit them into the chat feature. From the Compass, have any cases been reported from KCDC housing?
That's not information that we're comfortable releasing. similar to what I talked about before, the risk of identifying a person or persons and the negative impact it could have on their lives.
Any other questions? Please go ahead and submit them now. Okay, if there are no other questions, we appreciate you all joining us. Thank you so much. That's it for us.